If you've ever wondered why your feet seem to feel more sensitive at night, more tingly, warmer, or slightly uncomfortable for no clear reason, there's something most people never consider. It's not always your shoes. It's not always your mattress. And it's not always just getting older. Sometimes the real cause is something much more ordinary. Something you probably do every single day without even thinking about it. Your eating habits. Hi, I'm Dr. Alan Brooks. And over the years, I've noticed that many adults dealing with nighttime foot discomfort share one common pattern. During the day, they feel mostly fine. They can walk, cook, run errands, spend time with family, and nothing seems alarming. But at night, when they finally lie down and relax, their feet start to feel different. Maybe a little warm, maybe slightly tingly, maybe restless or sensitive against the sheets. And they can't figure out why it happens at almost the exact same time every evening. And when something happens that consistently, it usually isn't random. The surprising answer often has less to do with the outside of your feet and more to do with what's happening inside your body all day long. Let me explain something in very simple terms. Your nerves are living tissue. They're not just wires. They're not just cables sending signals. They're made of cells that need oxygen, nutrients, and steady circulation every single day, just like your muscles, just like your heart, just like your brain. And because they're living tissue, they're very sensitive to changes in your internal environment, especially blood sugar and circulation. When your blood sugar rises too quickly or too often, which can happen with frequent sweets, refined carbs, or large heavy meals, it can create small amounts of irritation inside the tiny blood vessels that feed your nerves. These vessels are extremely delicate, much smaller than most people imagine. And when they're stressed repeatedly, even slightly, the nerves they support don't feel as comfortable as they should. This doesn't mean damage happens overnight. It's usually much more gradual than that. Think of it like sun exposure. One day in the sun doesn't cause a problem. But small exposure every day for years slowly changes your skin. Nerves behave in a very similar way. Small daily stress adds up quietly. Over time, this irritation can make nerves more sensitive. Not dramatic, not painful at first, just more reactive. And when nerves become more reactive, small sensations start to feel bigger than they should. A bedsheet brushing your toes feels noticeable. Warmth under the blanket feels hotter than usual. Pressure from lying still feels uncomfortable. Things that never bothered you before suddenly feel irritating. During the day, though, you rarely notice this because you're distracted. You're moving, talking, watching television, driving, thinking about 100 other things. Your brain filters out those small signals automatically. But at night, everything changes. The house gets quiet, the lights go off, your body stops moving. And suddenly, there's nothing competing for your attention. So your brain turns inward, and every tiny sensation becomes louder. What felt invisible during the day suddenly feels uncomfortable at night. This is why so many people tell me, "Doctor, it only bothers me when I lie down." It's not that the problem starts at night. It's that night finally gives you the chance to feel it. Think of it like a car engine. If you press the gas pedal hard all day, the engine runs hotter. It still works. But it's under stress. If you then park the car in a quiet garage, you suddenly hear every ticking and clicking sound from the engine cooling down. Your nerves are similar. Frequent sugar spikes are like pressing the gas pedal over and over again. The nerves don't fail immediately. They simply become a little irritated, a little overheated, a little sensitive. And irritated nerves are the ones that tend to burn, tingle, or feel restless when you're trying to sleep. The good news is, this doesn't mean you need extreme diets or complicated plans. In fact, drastic changes usually backfire. Simple, steady habits tend to work much better. For example, spacing out meals more evenly during the day can help. Avoiding very sugary snacks late at night can help. Choosing balanced meals with protein, fiber, and healthy fats instead of only refined carbohydrates can help keep blood sugar steadier. When blood sugar stays steadier, circulation tends to stay steadier too. And when circulation stays steady, nerves usually feel calmer. Hydration helps as well. Blood that flows smoothly delivers oxygen and nutrients better to those tiny nerve endings in your feet. Even mild dehydration can make circulation less efficient. Something as simple as drinking enough water throughout the day can support your entire system more than people realize. Gentle daily movement also plays a big role. Light walking after meals, stretching your legs, moving around instead of sitting for hours. These small actions help your body use sugar more effectively and keep blood flowing down into your feet. It's not about exercise programs or intense workouts. It's about keeping things moving consistently. And just like we talked about in previous videos, external comfort still matters too. Soft footwear, gentle stretches, relaxation before bed, reducing pressure on sensitive areas. All of these small steps add up. But many people notice something interesting. When they support their nerves from both directions, outside and inside, the difference becomes even more noticeable. That's why some of my patients choose to add a simple natural nerve support formula to their daily routine. Something easy and consistent, just capsules. No complicated steps, No mixing powders, no strict schedules. The goal isn't to replace healthy habits. It's simply to give your nerves steady daily support from the inside, so they're less reactive overall. When nerves feel nourished and supported day after day, many people find they don't flare up as easily at night. They feel calmer, more stable, less sensitive. I actually recorded a short presentation explaining how that internal support works and why so many people prefer it because of how simple it is to stay consistent. If you'd like to learn more, you can find that link below this video and watch it anytime. The key message I want you to remember is this: nighttime foot discomfort isn't always random, and it isn't always something you simply have to accept. Sometimes it's just your body gently telling you that something during the day could use a small adjustment. And small adjustments, done consistently, often make a much bigger difference than people expect. If you found this helpful, subscribe for more simple, practical tips designed especially for adults over 50. Take care of your feet, stay consistent with your habits, and I'll see you in the next video.